How has the focus of the course shifted during its 4-year life?
We are now going into the 5th year of the program. As you're aware, the fields of international public health, of global social movements, and of global politics is evolving and changing very quickly. I mean, one of the things we are moving more and more into now compared to when we started the course was to look at the global context, the link between the micro-local and the global, how global social movements can be mobilized to help communities. So that's a particular focus. I mean, within the field of communities, there's a growing emphasis on looking at how programs such as microfinance, community cash transfers, can mediate between social inequalities and health. We're building up that focus. Partly under pressure from the students, really, we're putting in quite a lot more of a focus on community arts. We've had a lot of students that have been interested in community arts, the role of theatre, the role of visual programs such as Photo Voice and whatever, in working with people to bring about critical reflection and social change. I'm particularly interested in the whole issue of what counts as evidence in public health internationally. As you know, internationally, the randomized control trial is regarded as the gold standard method for evaluating health and development programs. And clearly, randomized control trials have their place, but I think that unless they're supplemented by more qualitative approaches, which enable us to look at how health and social development programs impact on communities, the extent to which they resonate with community needs and interests, or the extent to which they're just imposed from the outside by professionals from northern countries or wealthy parts of the city. How can we develop better methodologies for evaluating programs which focus more closely on the fit between health and social development programs on the one hand and the needs and interests of the communities that they work with on the other?
What do students do after they finish their studies here?
Most of them go into the fields of public health, social development, and health promotion, and they go in at various levels. Some students go straight into international organizations. So say in the last 2 weeks, I've spoken to somebody who works at one of our old students who works at the International Oral Health Federation in Geneva. I've spoken to another student of ours who works in Brussels in the European Public Health Union. So people do that kind of thing. Or else we have students that go into more sort of national things. And I've got one old student who's working as a nutritional health advocate in Washington, D.C., another one who's working in the Pediatric AIDS Foundation in California. We have a lot of students that go into research institutes and agencies. We've got somebody in the Tata Institute of Social Sciences in India. We've got somebody in the Health Economics and AIDS Research Unit in South Africa. A lot of people in health and public health-related agencies in England, interestingly, in areas of mental health. Primary care trusts. We've got somebody who's a health inequalities manager in the National Health Service. We have a lot of people who go into sexual health. I'm particularly interested in sexual health, but we have a range of other health interests in the program. But a lot of our students go into sexual health jobs all over the world. Some students who set their sights eventually on getting jobs in international health agencies prefer to go first and work in local settings in poor countries to get some kind of grassroots experience, which they see as an eventual stepping stone into an international development agency. So really our range of careers are very broad. We have people in the International Health Alliance in Brighton. We have people doing international AIDS work in Cambodia. As you can see, our students are out there. And that is very affirming, I think, for all of us who've put so much work into setting the course up, because we feel that we really have something that's of added value to contribute to the field of public health and to the field of social development. And it's wonderful to see all our students out there kind of blowing the HCD trumpet in the world so successfully and with such passion and such grace.
So what are the challenges facing the field of health, community, and development?
So I think the main challenge that the health, community, and development field is facing is that we've won the battle at the level of rhetoric and policy. I don't think there's anybody that denies that communities need to be involved in programs to tackle social inequalities, to improve health, to counter poverty, and so on. The rhetorical battle has been won. I think that there are a lot of very progressive, community-focused policies out there. However, for those of us who've worked in the field, it's not always easy to turn that pro-community rhetoric into action. And I'm particularly interested in the whole issue of political will. To what extent, I mean, this has been identified as a key factor in the recent World Health Organization Social Determinants of Health report, is that key to the kind of global problem of tackling health inequalities is political will. To what extent does political will exist nationally, globally, to tackle these inequalities? And I said to you earlier that powerful countries or powerful groups within countries seldom relinquish power without a significant push from below. And that's why I think on the program we are so interested in building the capacity of communities and of civil society organizations to really, using local, global, and international networks, ready to put a lot of pressure on governments and on international agencies to take the kind of community brief more seriously. And I think our students are playing a big role in doing that. And hopefully also we're doing that in our research. I think that we, in our own research, we're really very keen to develop frameworks of understanding and action that constitute some sort of roadmap for those who are seeking to turn the pro-community rhetoric into concrete interventions and concrete settings.
So what do students like most about the program?
I think there are three things the students like about the program. The first thing that they like is each other. There's a tremendous international diversity in the group. Virtually all the students have had some experience working in health or community projects as volunteers or in paid work before coming to the program. So there's a lot of intellectual richness. Students learn a huge amount from each other. They also like each other because of the warmth and support that seems to kind of come out of a group of students that are particularly interested in communities and in working with and as communities. The second thing they like are the teachers. I think that we at the LSE, what our added value is over many people who work in this area is that although we are all hardcore academics and very committed to academic theory, we see that, as Kurt Lewin said, there's nothing as practical as a good theory. We have no interest in theory as an abstract intellectual tool. We're only interested in ideas as tools for action. And I think the students like that a lot. And the staff in the department have had a lot of concrete development experience in contexts in Africa and South America, Eastern Europe, India, and so on. So the students like that. I think the Institute of Social Psychology is a small postgraduate institute, and I think they find everybody very supportive, the administrative staff, the technical staff. We really work very much as a team and a family in the way that a small kind of highly focused institute can do. And I think the students like that as well.